My topic is depression, that is, in which we learn about effect, cause, and treatment. That is guided by Dr. Hina Chawla ma'am, faculty, value education, psychology counselor. When we see the word depression, then first question arises in what is depression? Depression क्या है? Depression is a common mental disorder that presents with depressed mood, loss of interest or pleasure, or feeling of guilt. Now there are some symptoms of depression. The first symptom shows is the isolation. सभी अपने आप को सभी लोगों से दूर कर लेना. सेकंड थिंग इज नो एनर्जी. कोई भी काम करने में पूरा मन न लगना, ध्यान नहीं देना, एनर्जी नहीं होना. नो कंसंट्रेशन. हम काम कुछ और कर रहे हैं, ध्यान कहीं और है. एंगर. छोटी छोटी बातों पे गुस्सा आ जाना, किसी पे भी गुस्सा कर लेना. सैडनेस. हमेशा अपने आप को गलत फील करना, मतलब महसूस करना. नो एपेटाइट. भूख ना लगना. अल्कोहल एंड ड्रग एब्यूज. अल्कोहल लेने लगना, ड्रग लेना, किसी को भी छोटी बातों पे गालियां दे देना. स्लीप प्रॉब्लम. नींद ना आना. थॉट ऑफ डेथ. मरने की, मृत्यु के बारे में सोचने लगना. गिल्ट. अपने आप को हमेशा गलत समझना. Now there are some common causes. The first one is brain chemistry. There may be a chemical imbalance in parts of brain that manage mood, thought, sleep, appetite, and behavior in people who have depressions. The second one is hormone level. Change in female hormones, estrogen, progesterone during different period of time, like during the menstrual cycle, postpartum period, premenopause, or menopause, may all raise a personal risk for depression. The third one is family history. You are at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events affect the way your body reacts to fear and a stressful situation. The fifth one is brain chemistry, brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happened before or after the onset of depressive symptoms. Medical condition. Certain conditions may trusted source put you at higher risk, such as chronic illness, insomnia, chronic pain, Parkinson disease, stroke, heart attack, and cancer. Substance use. A history of substance or alcohol misuse can affect your risk. Now the last one is pain. People who feel emotional or chronic physical pain for long period of time are significantly more likely trusted source to develop depressions. Now here are some stats. Depression is a common illness worldwide with an estimated 3.8% of population affected. In whole world, 3.8% of population are affected of depression, including 5% in adults and 5.7% among adults older than 60 years. Approximately 280 million people in world have depressions at this point of time. Now this is some list. That is 300 million people worldwide experience depression. 300 मिलियन पीपल के पास जो डिप्रेस्ड है, ये WHO 2017 का रिजल्ट है. मीडियन एज ऑफ ऑनसेट जो होता है वो 32.5 ईयर्स ओल्ड होता है, वो मीडियन एज होता है. 3.1 million people between age 12 and 17 in the US have experienced at least one major depressive episode in past year. Now, suicide is the second leading cause of death among people ages 10 to 34. Nearly 50% of those diagnosed with depression also have an anxiety disorder. Depression is a very treatable, but 35% of adults receive none. डिप्रेशन एक ट्रीटेबल चीज है, लेकिन 35% लोग उससे निकल नहीं पाते हैं. अभी के लिस्ट के अनुसार 8.7% वुमेन जो है उनके पास डिप्रेशन है और 5.3% मेन जो है वो डिप्रेस्ड है. Now here are most common types of depression. Major depressive order, second is persistent depressive order, third is bipolar depression, fourth is postpartum depression, and fifth is seasonal depression. Now, as we all know, World Mental Health Day is on 10th October. Now the first comes is major depressive disorder, a mental disorder characterized by a persistently depressed mood and a long-term loss of pleasure or interest in life, often with other symptoms such as disturbed sleep, feeling of guilt, irritability, anxiety, depression, depression can also affect emotional regulation, mood changes, mood changes, mood changes, mood changes, mood changes. or disorder, also called dysthymia, that is dysthymia, is a continuous long-term chronic form of depression. You may lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem, and overall feeling of inadequacy. Those feelings last for years and may significantly interfere with your relationships.
वॉइस नहीं आ रही है।
यस मैम, वॉइस नहीं आ रही है।
Decreased activity and productivity. Now, the third one is bipolar depression. Bipolar depression, formerly called the manic depression, is a mental health condition that causes low depression. Bipolar mania is diagnosed. Reduced need to sleep, racing thoughts, inflated self-esteem, are easily distracted. Now the fifth one is postpartum depression. Postpartum means the time after childbirth. Most women get the baby blues or feel sad or empty within a few days of giving birth. For many women, the baby blues go away in the 3 to 5 days. It is the result on the 14th May 2019. Now the fifth one is seasonal affective disorder. Seasonal affective disorder, that is SAD, is a type of depression that's related to change in season. SAD begins and ends at about the same time every year. If you are like the most people with SAD, your symptoms start in fall and continue into the winter month, sapping your energy and making you feel moody. Now, here are some points to how to overcome with depression. First point is let's yourself be sad for a day. एक दिन के लिए अपने आप को उदास रख लो. Experience nature, go for walk or exercise. किसी छोटी वॉक पे जाओ, एक्सरसाइज करो, प्रकृति के साथ कुछ देर कभी बाग बगीचे में कहीं पे घूमो. ज्वाइन ए ग्रुप और बी अ पार्ट ऑफ कम्युनिटी. किसी एक ग्रुप में ज्वाइन हो जाओ या किसी कम्युनिटी में जाओ जहाँ वैसे कोई भी बात पे बात करो, सब लोग से इंटरेक्ट करो. राइट डाउन व्हाट यू आर थैंकफुल फॉर. एक पेज लो जिस पे लिखो कि तुम किस किस के लिए थैंकफुल हो. तुम अपने अच्छे वर्क को उस पे लिखो कि तुम्हारे लिए किसने अच्छा किया, जो बुरे किए उन्हें छोड़ दो. राइट डाउन थैंकफुल वर्क फॉर, तुम किसके लिए थैंकफुल हो. फाइंड अ बैलेंस विथ फैमिली. अपनी फैमिली के साथ बैलेंस बनाओ, फ्रेंड्स के साथ, फाइनेंसेस के साथ, फिटनेस एंड फूड. नाउ थैंक यू मैम. एट लास्ट थैंक यू.
Okay.